Hi, I'm Dr. Christina Popa.
And I'm Ali Khan Suleiman. We are the 2023-24 Core Leadership Council co-chairs for the Eastern York Region North Durham Ontario Health Team, or the EYRND OHT. Today, we're excited to take you through some of the key achievements from this past year. It's hard to believe. It's been 4 years since the Ministry of Health announced the establishment of our OHT. Since December 2019, we've been on a remarkable journey, working together to deliver integrated programs and services that connect care to individuals, families, and caregivers in a meaningful way.
Our OHT is built on the strength of 17 core partners, with many more organizations collaborating with us on specific initiatives. Our partnerships have only continued to strengthen over the years, driving us to improve the quality of life for people in our communities. As our population continues to grow, advanced integrated care becomes not just important, but essential. Let's take a look at how, together, we've made progress towards the goal.
When we ask patients what integrated care means to them, they often say it's care that is both timely and seamless, where providers work together as one team. This vision of truly integrated, patient-centered care is at the heart of the Central Ontario Region Virtual Urgent Care Clinic and the Community Health Clinic, two major initiatives launched in 2023 through our Ontario Health team in partnership with Oak Valley Health and Ontario Health. The Virtual Urgent Care Clinic, the first of its kind in Central Region and only 4 others in the province, connects patients across Central Ontario to a nurse practitioner for non-life-threatening urgent care. It seamlessly links patients to local providers, ensuring they receive follow-up care. Those without a family doctor in our area are referred to the Community Health Clinic in Stouffville for further coordination and access to community services. Since launching in July 2023, the virtual clinic has already served over 2,300 patients, just under 20% of whom didn't have a family doctor, helping bridge critical gaps in care.
Patients can schedule a same-day or next-day appointment with the virtual clinic by directly booking online or through Health 811, which serves as Ontario's digital front door to health and social resources. Within the Central Ontario region, there are 5 million patients that are available to use our services. Our virtual care is a bit of a game changer for patients in Ontario looking for timely access to health care. We provide same-day or next-day appointments for patients who require to be seen for a variety of primary care conditions. Now, these are patients who would otherwise be waiting a very long time in order to see their primary care provider or end up in emergency. Our virtual clinic sees patients who have OHIP and don't have OHIP. We also see patients that have a family doctor and patients who don't have a family doctor. In Ontario, there is a lengthy wait list for patients to access high-quality mental health care. So we effectively built an in-house team that was able to reduce the wait times and offer the mental health support for the patients that needed in the Central Ontario region. So it's a mixed bag of both acute episodic conditions as well as primary care needs. In the Stouffville and Markham area, we are also able to refer them to in-person assessment at our CHC, which is our sister clinic, where they can have an in-person assessment. And what this will do is also help patients become empowered to take charge of their own healthcare and become active participants in their healthcare.
My name is Imogen, and I live in Markham. I've been in Canada since 1970, and I came here with my husband, who was coming to U of T to do his second degree. I was a teacher at home in Trinidad, and I became a teacher here. I was going through a really bad period after my husband died. I was having a lot of problems with my knee because I had had a fall, and it was all the ligaments that were torn. But my doctor, my orthopedic doctor, retired, and I had no one. However, when I heard about the virtual care clinic, got in touch with them via the internet, and there on the screen, this lovely lady came up, and it was Karen Curry. She was so welcoming, so caring when she started to speak. and it was totally patient-centered. She gave me a requisition to go to Markham Stouffville, and I went there, and there was no wait in the emergency room. You just went, you registered, and you went straight to X-ray. I couldn't believe anything like this. And then when I came home the next day, Karen called again to see if I got through and how did the X-rays go. She said, okay, she will be calling me again when she gets the results. I'm now in line waiting to see the orthopedic surgeon to get the injection. So I'm very, very pleased and I'm hopeful.
My impression of the virtual care experience was very, very positive. And in fact, I would say that it exceeded my expectations. I think that that's one thing that Ontarians really want, is that they want to know that healthcare services are readily available and that they can get the same quality of care in a virtual setting.
The Community Health Clinic, led by nurse practitioners, opened in May 2023. While it offers a wide range of services, the Children's Rapid Access has been impactful, especially around cough, cold, flu season. The service provides urgent pediatric care for children 6 months and older, and we address immediate health concerns or connect children to specialized care where needed. The Children's Rapid Access fills a crucial gap for families without regular access to a family doctor or nurse practitioner. At the Children's Rapid Access, we have partnerships with two different organizations. We have it with Oak Valley Health as well as Ontario Health, or OHT. And so through them, we have access to many different clinics, resources, and hospitals throughout the surrounding area, including the Markham and Oxford Hospital. And so through with them, if they do need a specialist referral, for example, respirology or an allergist, we can refer accordingly because we do have that partnership. We always ensure that there's always a good follow-up plan for every child that walks through our door and ensuring that their families feel well supported during this process. The goal is really just to ensure that people are getting appropriate care and then timely follow-up, whether that's through us, a specialist, or another provider. Since the launch, the Community Health Clinic has served about 3,000 patients, with about 15% of them not having access to primary care providers. As for the Children's Rapid Access, it serves about 1,500 patients, with 5% of them not having a primary care provider.
I'm a mother of two. One is 7 years old and one is 3.5. So I remember last winter was the first time that we used this service. My daughter was sick and we were not able to get a hold of her pediatrician. We learned about this service from a friend, and we're able to make an appointment quickly, and it helped her to get the proper diagnosis and treatment. So after finishing her prescription medication, she fully recovered after a week. And it really helped us because you can work with your own schedule and you know exactly when you can be seen by someone. Our first impression with the staff and everyone in the clinic was very good. They're all very friendly and very professional.
Hearing from members of the community drives us to keep advancing integrated care and delivering the best patient and client experience possible. Looking ahead, we have exciting plans to further this vision. Our team will be working closely with partners to strengthen our primary care network, building integrated clinical pathways, and improving palliative care. The Community Health Clinic in Stouffville continues to be an integral part of providing the community with access to health care, and we plan to expand into Uxbridge this year as well. This is just a purview of what's in store as we continue advancing integrated care across our communities.
It's been an incredible year for our Ontario Health team. Year after year, we are defining a path that enhances patient outcomes, improves provider experience, and advances cost-effective care, all while progressing to make integrated care a reality.
Thank you for joining us on this mission to advancing integrated care. We look forward to your continued support and collaboration.